straight to it. India has crossed the 50 lakh mark. It's not a milestone that anyone wants to celebrate. The number looks scary, quite frankly. We're, of course, at the number 2 position the world over now. But while we're talking about COVID-19 and the statistics around it, it's important to look at it from a more nuanced view. And that really depends on who you speak to. Now, government will always project the data that shows us in a good light, while critics always look at the data that is the most alarming. We here at ET Now are bringing you a 360-degree view and all aspects of the data. So let's take a look at factors working in India's favor, largely perhaps because of things like a younger population, etc. So yes, we do have 50 lakh cases, but we also have a high rate of recovery. In fact, a rate of recovery for us is now at 78.53%. So that's the part of good news. The other good news, so to speak, and here I'm saying good relatively, is that we have fewer deaths per million. In fact, one of the lowest in the world. We have 55 deaths per million. But you have to remember, this is also a function of the large base and the large number of our population. The mortality rate is less, the infection rate is less, recoveries are improving, vaccine opportunities look brighter because one of the largest manufacturers of vaccine in the world is the Serum Institute of India, which is based in India. Let's look at what is not so great now. We've climbed to number 2 fairly quickly. Our number of new daily cases is also consistently high, hovering between 90,000, 80,000, sometimes close to 1 lakh, and that's increasing. If you compare that with the United States, which has the highest number of cases, our daily cases are a real problem. Whereas in the United States, it's about 34,000, 35,000 new cases a day. In India, the latest is about 84,000 new cases per day. So that's definitely an issue. The medical infrastructure has still not come up to par even so many months after COVID-19. So whether it is ventilator beds, whether it is ICU beds, or even if you look at reports of oxygen running out in certain hospitals, all of these are issues. The other major issue that we are seeing is that people have just stopped bothering about social distancing, and perhaps that is leading to a higher number of cases. We're going to talk about some of these aspects because all of this is happening while India continues to unlock, and we have to unlock. So how do the two sit together? Speaking to us now on the show today are Dr. Arvinder Soin. He's the chairman of Medanta Liver Institute and the national lead investigator on a multi-center trial on one of the drugs being used for COVID-19 treatment. I have Dhrubabrata, Ghosh, Dastidar, who's the director data and analytics at Protiviti India. They've been bang on in their projections so far. We're going to ask him about the numbers and statistics. And Niranjan, Hiranandani, president of ASSOCHAM, also joins us on the show. Welcome to all of you, and thank you for speaking with us today. Dhruba, I want to come to you first on the numbers because we're talking about the 50 lakh mark. In one of your earlier reports at the end of July, in fact, you looked at September 7th as the peak. What has changed between the end of August and early September, and what is your current projection of the peak now? Tell us, encapsulate for us what the current situation is and why our numbers are growing so rapidly.
So if you look at around about the mid of August to the end of August, we were seeing a steady decline in the number of net new cases. Net new cases means the number of confirmed cases minus the recoveries that happens in a day. That was steadily going down till around 20th of August when it took a U-turn and started going up again. And if you look at the two states, which is Maharashtra and Delhi, they were the majorly contributing states which kind of took a U-turn and started growing much faster. Now, I believe that it has to do partly with the unlocking, partly with the festive season as well. But more than that, people not perhaps maintaining the social distancing. As you rightly said, we have to unlock. But as with the unlocking, we have to be more cautious as to how we keep these numbers under control. And that's perhaps got lost somewhere, and we started seeing a second peak, if you call it, for places like Mumbai, Pune, Thane, Delhi. And this is clearly visible in the numbers, right? And that's one cause of concern. On the peak, it has definitely shifted by a month or so. We are looking in mid of October timeframe and upwards of around 12 and a half, 13 lakh odd cases, active cases during that time. But if you leave these two particular states, Maharashtra and Delhi, what you will see is a lot of the other states have kind of flattened the peak. It's not increasing, and neither it's decreasing, but it's kind of constant. It's a plateau, and they have been able to maintain that for quite some time. So that's one good part, but definitely the two states, which was the epicenter initially, continues again to be the cause of concern.
Yeah, so one very important point you made there is about a second peak, Dhrubo. That's why I'm going to come to you for a quick follow-up. Are you saying we're already hitting a second peak in Maharashtra, especially Mumbai and Delhi?
We are moving towards the second peak. So if you look at Bombay as an example, during the July timeframe, it reached around 30,000 odd cases and started going down. It went down to around 20,000 cases. Now it's back again in the 30,000 mark, and it continues to grow. So definitely we are looking at a second peak for Bombay. Same for Delhi and Pune and Thane. So we actually are seeing a second peak in these areas.
Another set of data that I want to draw the viewers' attention to is the pace at which we have gone from 10 lakh cases to 50 lakh cases and how rapidly it's been increasing. And just, stay with me. We were at about 10 lakh cases on the 16th of July, and it took us 135 days to reach the 10 lakh mark. It took us just 21 days to go from 10 to 20 lakh cases in India, 16 days to go from 20 to 30 lakh cases, 13 days to go from 30 to 40, and just 11 days to go from 40 to 50. And that really, I would say, is the most worrisome part. Dr. Soin, I want you to come in here. Are we sort of losing the plot somewhere where we're not able to calibrate how we open up?
Tamanna, there are two things at work here. One is we are testing more, so we are detecting more, which is obvious. And the other is the number of cases is also rising. I don't know if it's really the second peak or if it's just the first peak and we had a slight blip or a slight downward trend for a couple of weeks. But it's clearly rising, and everybody can see that. And, like Dhruba said, probably we're going to peak out somewhere in the next month or 6 weeks. So, yes, I think as far as the social distancing is concerned, as far as masking is concerned, we have lost our plot a little bit, and that must be adhered to. I mean, look at the second peaks happening all across the world, and that's the same thing. They're unlocking, they're not paying attention to masking and, avoiding crowds, and that's going to happen to us as well. So that's something that we just cannot let go. Now, there are some professions, there are some places like restaurants, like gyms, like malls, where you just cannot avoid a degree of crowding, like worship places. And if you don't open them, there is an outcry, there's an economic loss. So we really are stuck. So it really depends on our own moral fiber to make sure we are masking and keeping our distance as much as possible. Otherwise, of course, the numbers are rising.
Yeah, but Dr. Soin, I'm sorry, but when I look at how other nations have dealt with coronavirus pandemic, their numbers are lower and they've opened up much more. We're talking about Mumbai, Maharashtra being one of the epicenters. Theatres are not open, in restaurant dining is not open, the train service is not open in Mumbai. And if I compare this with other countries, with some other countries which have managed to flatten the peak and open up much more. So clearly there is something we're not doing right.
The thing is that they may have opened up more, but they are less dense countries. You must understand that we are a very, very densely populated country. And the areas that you're talking about, I mean, Thane, Pune, Mumbai in general, Delhi included, I mean, all these places are extremely densely populated. So you are going to have a spread of infections as unlocking happens. I mean, when I go to work, I take about approximately the same time that I used to pre-COVID time. So people are on the road. So, with the crowding, it's definitely going to affect us more than it affects other countries where the population is less dense.
Mr. Hiranandani, I want to get your perspective from, the business side of things. We know that we have been unlocking rapidly and we need to. We knew that with that unlocking will come some increase in cases, etc. But is this spike in cases now becoming a hindrance to the whole process of recovery itself? What has been your experience on ground?
Two aspects. First aspect is, yes, there is a concern about the rise in numbers. There is no doubt about it. The second part of it is slightly easier to accept, which is the fact that we still have sufficient number of beds to take care of the people who are requiring medical attention. And all these things have been quite well balanced out as of now. I don't know about tomorrow morning, but as of today, I can certainly say that we have adequate medical facilities to take care of the symptomatic cases. As far as the asymptomatic cases are concerned, they are being looked after at home, and many of them are connected to hospitals for the purposes of some services that they may require in terms of guidance and medical assistance. But by and large, as long as we have adequate medical facilities available to take care of the situation, we cannot but help to open it out. And I think there is a feeling still that the opening out is not adequate enough. The High Court in Mumbai is giving orders that the lawyers should be allowed to come in the trains. But what about the rest of the people? I mean, why should lawyers be exceptions and not journalists, for instance? Or why not other people in different essential services that require to use trains? So this opening out is definitely going to take place. We are definitely concerned. But as long as the health facilities, the ICUs, the bed availability and others is taking care. And what Dr. Soin said correctly.
Well, I mean, Mr. Hiranandani, you run a hospital.
More testing.
You run a hospital, so give us a perspective. Give us a perspective, because you run a hospital as well. There are numerous reports in different parts of the country of oxygen now becoming a scarce commodity, and that being the next hitch. In Mumbai itself, we saw a few months ago a problem of a shortage of beds. You're saying all of that is sorted right now?
Well, as of, let me share with you. 2 weeks ago, we found that there were gross surpluses of beds. So the municipal corporation gave an order that private nursing home having less than 50 beds cannot become COVID hospitals. So they were looking after COVID patients. They've been asked not to do so. Yesterday, this whole decision-making has been topsy-turvied again because the number of patients have increased. So nursing homes have again, subject to certain size and scale and requirements, have been asked to get back to treating COVID patients also. So the answer is yes, it is, but it needs constant calibration, because what was actually happening by having 80% of the hospital beds only for COVID, we found cases where there were heart attack patients which could not get a bed because the hospitals had all turned COVID hospitals and there were no hospital beds for other people who were non-COVID. So I think this requires constant calibration to see what should be COVID and non-COVID, and this balance will continue because no one has the knowledge and experience to give the exact numbers. But this is going to grow as we open out, and there's no alternative, Tamanna, but for opening out now. 6 months is too much of a time, really, for it to have, economy still to be closed down. Lots of institutions, lots of people are still suffering. And we can't but help but open it out, Tamanna. I don't see any alternative to it. But yes, if we do find...
No, absolutely. I agree with you there. Because...
Can I come in for a minute? Yeah.
Yes, I agree with you there because look at it. The lockdown didn't really help. Yes, Dr. Soin.
So, taking on from what Niranjan has just said, let me say that we know how to treat corona or COVID much better than we did 6 months ago. There's no doubt about that. I mean, despite rising numbers, the death rates are actually falling all across the world. And these protocols have actually been, sent across and shared with every hospital that's a COVID hospital. So, I request the patients who have COVID in, let's say, tier 2, tier 3 cities, not to rush to Mumbai and Delhi and, crowd up hospitals and be on the waiting list and disappointed. They should be in their own hospitals in their own cities. Everywhere. I mean, Agra, Nagpur, Mathura, there are hospitals which are very competent to take care of most of the patients, like 97, 98% of the patients. So I find patients are actually rushing in to the major cities and crowding up hospitals for no rhyme or reason. And those hospitals are running out of facilities, whereas it doesn't have to be that way,
Okay,
And the protocols
I got the
are
important point. Before I wrap this very crucial, yes. Before I wrap this crucial discussions, I want to go to the numbers guy and just Dhruva, your numbers and what do they show? What is the timeline as per your time scale and your predictions for the peak now for India? Range of date, please, as well as for Maharashtra and Mumbai.
So Maharashtra, Mumbai, India, all are around the 15th of October, which is around 4 weeks from now, 4 to 6 weeks from now. Right. So that's the time frame. What we have also realized is once it hits the peak, it will be a flat curve for quite some time before it starts dying down. So if you look at most of the states other than Maharashtra, Bombay and Delhi, they have been a consistently flat curve for quite some time. So yes, we are going to hit a peak and stabilize in another 3 to 4 weeks time.
Well, let's hope so. Let's hope so. And of course, we'll be back to speak with you in another 3 to 4 weeks' time. I've absolutely run out of time on this story, but I want to thank all of you for joining us on this crucial discussion today. We here at ET Now and on the India Development Debate are keeping our focus squarely on the issues that matter, and COVID-19 is number one on that list.